this morning. Dr. Diananda, good morning.
Good morning.
And yeah, like I say, crazy week for vaccine news. We had the J&J guidance, issues with the J&J vaccines that are still kind of on hold by Health Canada, the Pfizer approval for young people. We hit the 4 million mark in vaccines administered in Ontario yesterday. So vaccines are kind of leading the way right now in terms of news coverage, hopefully, and getting us out of this. Are you concerned at all? I was reading last night in the New York Times that some states have taken, 10% of their allotment of vaccines from the federal government south of the border. So it would seem like vaccines are plateauing south of the border as issues of hesitancy kind of crop up. Do you see any of that happening here at all?
Yes, I do daily battle with anti-vax misinformation and disinformation. There is some hesitancy, of course, and there comes in two categories. There is the polite, understandable skepticism of people who have, been subject to a lot of scaremongering, and then there is the hardcore, almost religious zealotry around anti-vax belief systems. So that last group, I don't know how to reach. That's going to be a sticking point for a while. But that first group, those who are, understandably hesitant, we approach them with compassion and with understanding and with information, and ultimately they will come around. But the larger question of, is that going to be an issue? Eventually it will. Right now it's not. Right now, demand outstrips supply. But that's changing fast because we're getting doses by the millions every week. So very soon, every Canadian who wants one is going to get a shot. Then, probably later in the summer, we're going to come up against the hesitancy wall.
And do you see it as being as, I guess, as poignant as it is that we're seeing in the United States right now? Joe Rogan, I'm sure as you saw, social media lit up this week. Obviously, there's some massive vaccine disinformation circulating in pop culture south of the border. Do you expect to be on that scale here in Canada?
No, I don't. I think it'll be similar, but not nearly as bad. The United States is far more bifurcated in terms of their belief systems, and it tends to fall on political lines as well as on geographical lines. With us, it's not nearly as bad, but it's still going to be here a little bit. The rollout to children is going to help, strangely enough. Now, I understand there's hesitancy amongst parents to get their children vaccinated, and I completely understand that. But from an epidemiological standpoint, opening up vaccination to this new cohort, which constitutes about 30% of the total Canadian population, that allows us to get to herd immunity a bit easier and doesn't require us to go deep into the anti-vax territory as we would have otherwise had to do if we only were relying upon the adult population to reach herd immunity.
And I guess what are reasonable concerns? You kind of talked about, this isn't, the vaccine is going to make me connect to 5G or Wi-Fi, right? But
right.
those are ridiculous, and to leave those aside. But what are some reasonable concerns that you
Sure.
do hear on a daily basis?
Well, pain. Absolutely. There's pain on the injection site. There's fatigue. Look, I had my Shingrix vaccine about 3 years ago, and I was knocked out for 2 days. And I understand what was happening. I got it, and I wasn't scared at all, but it was debilitating for 1 or 2 days. And as a result, I was scared to get my second dose. I got my second dose, but I was scared. So if you're not used to vaccines and don't understand the science, and suddenly you have this debilitating 1 or 2 days of fever and pain and fatigue, you might be thinking, what has this vaccine done to me? And if your friend has had the same experience, you think, I don't want to go through that. Then there's the rational conclusion from that. If you haven't got the ability to have someone take care of your child or fill in for you at work, then that's a day of non-productivity you have to account for. So that's a systemic infrastructural barrier to getting vaccinated. Then there are, the larger concerns. There is some data that very rarely the mRNA vaccines can cause some myocarditis, swelling of the heart membrane. So that's extremely rare. And of course, the AstraZeneca kerfuffle about the clotting issues, that's made its way well into society. Those are rational concerns, especially for people who aren't used to weighing the numeric risks, like the minute risk of something bad going wrong versus the very real risk of getting COVID and having something even worse happen to you. All right. So then you layer on top of that concern for your children, as we roll this out to children soon. Nobody wants to expose their child to a day of debilitating fatigue, which is rare, but does happen. And then there is the even rarer incidence of multi-organ failure that can happen. I don't want to scare people by saying these things. You can look up the incidence rates yourselves. But we don't do anyone a service by denying that these are real. These are real adverse events. They're just extremely rare. But that doesn't help you if you're the person who got the rare event, right?
Yeah, exactly.
Yeah, so that's the concerns here. And what I try to do is walk people through how to do the math and to make decisions on their own. And they should really talk to their family physician. And if you're thinking about your child, talk to your pediatrician, who might fold in an immunologist in case you or your child has a family history of certain kinds of reactions. Again, I'm not a medical doctor. I can't advise you on these issues. But what I advise is speak to your general practitioner if you have medical concerns specific to your condition. But in general, looking at the rates of adverse reactions can be terrifying if all you see are the reactions themselves and not how rare they are.
Right, and I think it is important to talk about them and to assess them as opposed to, looking like there's something to hide. So I'm glad you have addressed those kind of rare, I guess, instances there. When it comes to, I guess, the process here, what we have seen, you mentioned some of the side effects of this, some of the COVID-19 vaccines. I've seen it with some people that I've known that have gotten the vaccine as well, be it, just tiredness, a little bit of nausea for a couple of days, and then everything's fine. So there have been kind of side effects. I guess, is that the typical kind of experience that people are getting right now?
Yeah, the typical experience is nothing. Nothing happens to you.
Okay.
Then the next level down of typicalness would be pain at the injection site. Like I got vaccinated this week, and my arm hurts a little bit, but unless someone asks me, "Hey, how you doing?" I forget that I got vaccinated. I forget every day. My spouse got vaccinated. She couldn't lift her arm for a while, and that was hard carrying a baby around. But those are the typical things. I have some friends who, had to spend a day in bed. I have some friends who got a rash, but again, all these things clear up in a couple of days. I don't mean to minimize concerns, not at all.
Mm-hmm.
But we have to understand that when a vaccine like this is rolled out to tens of millions of people, hundreds of millions worldwide, of course, even these extremely rare events are going to be more present. That's a law of large numbers. And media being what it is going to focus on those events and amplify them. But this is nothing new here. Just keep remembering what you're protecting yourself against. A potentially lethal disease that has shut down the world. This is our way out. Vaccination is our way out. Make no mistake about that. And the faster we get shots into our arms, the better.
Of course. And last one for you, Ray, just in terms of that vaccine rollout here in Ontario, I guess sort of last one, but we have seen it pick up steam over the course of the past week and a half or so. Doing some quick math last night, everybody should have a first dose, it seems, in the next 60 or 70 days. Is this going to move as quickly as I think it is?
Yeah, I think it's going to move really fast. And I was so impressed with the way the vaccine clinics are run. They're very efficient, pleasant. And I think we've learned our lessons about the poor rollout these past few weeks or months. I mean, I've been saying that throughout. I've been wrong every time, but I think I'm right this time. And we're going to be knee deep in vaccines very soon. Now, that doesn't mean we're out of this. We still have a full ICU unit, and it's going to stay that way for a few months. But the dawn is rising. And so the path out of this is clear now. It is vaccination. So get your shot.
Yeah, I'm going to hold on to that on this bright and beautiful Sunday morning. Dr. Ray White, United, thanks so much for your time today. I really appreciate it as always.
Thank you.